If you've been struggling with high blood pressure, you're not alone. According to the American Heart Association, 116 million Americans have high blood pressure. 50% are not well controlled. Worldwide, there is 1 billion people with high blood pressure. And high blood pressure, as we know, is a major risk factor for strokes, for heart attacks, for chronic kidney disease, for heart failure, arrhythmias, and dementia. If you're seeking ways to reduce your reliance on medication, this video is for you. Hello friends, I'm Dr. T, board-certified cardiologist and lifestyle medicine advocate. Today we're addressing potassium and its role in blood pressure. We're going to ask 10 questions and I'll have a bonus question at the end of the video. Stick around. Question number 1. Why is potassium important to our health? Potassium is a mineral element. It's the most abundant intracellular cation. It is present in all body tissues. It is required for normal cell function. It's absorbed primarily by the small intestine and used to maintain the normal intracellular extracellular concentrations and excreted primarily in the urine. Some is excreted in the stools and some very small amounts in sweat, but mainly by the kidneys. And the kidneys control potassium excretion in response to dietary intake. And the kidneys increase the potassium excretion rapidly in healthy people after potassium consumption. Question number 2. What are the normal potassium levels? Normal potassium levels in the blood ranges between 3.5 and 5.2 milliequivalents per liter or millimoles per liter. Less than 3.5 is called hypokalemia, and above 5.2 is called high potassium hyperkalemia. Levels above 6 are considered critical and need immediate attention. Number 3. How much potassium do we need per day? The National Academy of Sciences and Engineering and Medicine established that for adults 19 and older, adequate intake is 3,400 milligrams a day for men and 2,600 milligrams for women. However, the Institute of Medicine recommends a higher intake, 4,700 milligrams a day. And there's no question Americans eat too much sodium and not enough of potassium. Number 4, how does potassium lower blood pressure? We know that too much sodium is bad for blood pressure. The kidneys have a mechanism to excrete excess sodium, and the potassium helps the kidneys flush out the excess sodium instead of retaining it. In addition, the potassium eases the tension on the walls of the blood vessels, causes vasodilatation, relaxation, lowering your blood pressure. Number 5, how long does it take for potassium-rich foods to lower your blood pressure? The DASH diet, dietary approach to stop hypertension studies show the greatest benefit on blood pressure lowering levels within 2 weeks of starting the diet. And not only was blood pressure reduced here, total cholesterol was also reduced, the LDL. Number 6, what blood pressure medications lower the potassium? There's a class of blood pressure medications that are called diuretics water pills, and some diuretics like furosemide, bumetanide, torsemide, metolazone, and thiazides actually lower your blood pressure excreting sodium, but also get rid of potassium and magnesium. These medications are used to treat not only blood pressure but to treat congestive heart failure and swelling edema. Number 7, why blood pressure meds increase the potassium levels? So on the other hand, some diuretics are called potassium-sparing diuretics like spironolactone, amiloride, trientrin, and eplerenone. And these medications actually retain potassium. And the other medications used to treat high blood pressure and other conditions called angiotensin converting enzyme inhibitors, ACE inhibitors, captopril, enalapril, lisinopril, ramipril, and others. And angiotensin receptor blockers, we call them ARBs, losartan, candesartan, valsartan, irbesartan. These medications actually retain potassium in your body. Number 8, who cannot take extra potassium? Anybody with kidney disease should avoid excess potassium. Damaged kidneys lose the ability to remove excess potassium from your blood, so the amount can build up to dangerous levels, including leading to a cardiac arrest and death. And people on medications that increase potassium cannot take the extra potassium without talking to their doctors, and they cannot use salt substitutes either, like the one I'm showing here, this potassium chloride. That's what I use. If you have kidney disease, you cannot use them. It's very dangerous. In that situation, you need to cut the amount of sodium in your diet to lower your blood pressure. And to learn more how to cut down on sodium in your diet, watch this video, top 10 ways to cut salt in your diet. I'll put a link above and on the description below. Number 9, is potassium bad for your heart? Can too much potassium give you a heart attack? Yes, the hyperkalemia, the high potassium, can give you muscle weakness, and heart rhythm issues could even lead to a cardiac arrest. Cells have trouble responding to nerve impulses with too much potassium affecting muscle contraction. In addition, kidney disease and certain medications, crashing injuries that could cause cell damage and hemolysis can lead to too much potassium in the bloodstream. And I witnessed in my career many examples of people in a lot of trouble, on the brink of a cardiac arrest because they had too much potassium in their blood. Usually people who were in dialysis, for instance, missed dialysis. Number 10, are the sugars and potassium-rich foods bad for diabetes? It's a common myth that if you have diabetes, you shouldn't eat fruit, and that's actually not correct. The total amount of carbohydrates in the food affects blood sugar levels more than the source of the carbohydrates, and as long as you stay around no more than 15 grams of carbs, you are okay. Studies show that up to 200 grams of fruits a day actually decreases your risk of developing diabetes. Here's my bonus question: if you have normal blood pressure, would potassium-rich foods lower blood pressure to dangerous levels? No. Body will adapt, it will not drop your blood pressure to dangerous levels if you have normal kidney function. Summary: potassium is the most abundant cation in your body. It's vital to your health. Potassium-rich foods lower blood pressure. However, they are contraindicated if you have kidney disease or if you take any medications that increase the potassium. Talk to your doctor about this life and death issue before changing your diet. And remember, your health is your most precious asset. Take control. See you next video. Don't forget to subscribe.